So like I mentioned earlier, we're going to be having a didactic session from, okay, I just got word that Dr. Obey is back on. Dr. Obey, can you hear me, sir? Are you able to speak now? Team, please help me confirm that he's able to unmute and speak. Can you hear me, please? Okay, sir. Dr.
Yes,
Obey, are you able to
I
speak?
can hear you. I've been
Awesome,
trying to
awesome.
mute.
Okay,
Thank you
welcome,
very
sir.
much.
Thank you so much.
Thank you very much, Liz. Thank you. All right. Thank you very much. I say good afternoon to everyone. Apologies for joining late. And thank you, Chair Goze, for actually reminding me. And thank you, Liz, for your patience. I didn't pick your call again. All right. So it's so good to be here. And I thank the organizers of the program for the very inspiring coinage, as well as the very daring move to start improving quality of care in the Nigerian healthcare practice space. I think it's long overdue for us to be doing these things. And now that we have started, we should thank the people with the initiative. Mental health is actually key because when we don't have a head, there is a problem. It becomes a bigger problem when you have a head that is not thinking or is not working the way a head should work. Now, if the head is not working the way it should work, and you are just looking at it without being able to make diagnosis, it becomes another far complicated problem. Then we would actually know who is actually malfunctioning. But when we have someone whose mind is balanced and can engage in mutually productive or beneficial relationships, then we know the mental health is actually key, particularly when the guy possesses so much resilience as to adapt to daily tasks and, make something out of life. Then we'll give the person a pass mark. Maternal health care is key because, well, even though we don't know where to pitch our tent, perhaps it was the egg that came first or the chicken, but we know women are so valuable in our lives, and women make the world go round. And thank you very much for focusing on our women. Maternal health care is key. Patient-centered care is actually something that I like. I was just smiling while I was going through the pre-test questions, and it reminded me of residency days where we have to cram lots of things about patient-centered clinical medicine. But really, it's good. At least you would help us emphasize that the hospitals were built for the patients and not for the healthcare workers. So let me not take too much of your time. Thank you very much, everyone, for having me here. I will try as much as possible to listen through, and if my bosses should call for me, definitely I would have to drop out of the session. But I'll be with you in spirit. Thank you very much. Have a
Thank you
wonderful
so much.
session. Yeah.
Thank you so much, Dr. Olumide. That was a very warm, way to kick off the session. Thank you very much for the goodwill message. He said something very important about how women make the world go around. And isn't it amazing that today is International Women's Day? So just ask, craving your indulgence, to just put something in the chat box, just saying Happy International Women's Day to the women on the call, celebrating the women in the room today, for all the great sacrifices and work, bringing life, making sure that people, the world keeps going around, as you mentioned. Thank you so much, Dr. Olumide, for emphasizing the importance of this session. And we are excited to see the growth and the learnings that will come out as a result of the session. It's my singular honor and pleasure to also introduce our special guests, a seasoned doctor, practitioner, and even quality improvement expert. I'm just going to take a few moments. Thank you, Solomon, for celebrating the women. Anybody who is not celebrating the women in the chat is a suspect. Okay, so I encourage everyone, Happy International Women's Day, celebrate the women around you. Okay, so moving on quickly to just read the bio of Dr. Olabisi Ogunbase, who is Director of Clinical Services and Training, Maternal and Child Health Center at JA. She's a CMO in the Department of Pediatrics, the Director of Clinical Services and Training, and team leads of both the Quality Improvement and Infection Prevention and Control Committees. We're in for a swell session today. She has completed a postgraduate programs from Harvard, an online program, and Boston University School of Medicine in her fields of interest. In 2015, she got selected for the Quality Improvement Hospitals Initiative Program and served as the Pioneer Quality Mentors Team Lead. Presently, she serves as the Lagos State Health Service Commission Quality Improvement Leader, where she coordinates QI programs, that's quality improvement programs, of all the 2-level facilities. She's also a member of the Lagos State Ministry of Health Infection, Prevention, and Control Review Committee. She's a member of the WHO Global Patient Safety Network and serves as a member of the steering and the expert committees of the WHO World Patient Safety Day Group. She had an opportunity last year to give a presentation at its global conference at the WHO headquarters in Geneva, Switzerland. She's a member of QI societies, both home and abroad, and like the SQHN and IFHQS to mention but a few. Dear participant, thank you, attendants, special guests, everyone. We want to crave your indulgence to please celebrate and welcome Dr. Olabisi as she goes on to take her session. If you're not clapping, she will not speak. So please, I want to encourage you, celebrate her, thank her for joining the session and for coming to share, from our experts, share expert insights for today's session. So please clap with a round of applause. Dr. Olabisi, you are welcome. I'm happy to turn over the mic to you now.
Yes. Good afternoon, everybody. Happy International Women's Day. Can I put on my video?
Absolutely.
Yeah, but I'm getting a sign you cannot start your video because the host has stopped it.
Oh, let me try and fix that.
Thank you.
Yes, please. All right, but I think you can go on to speak now while we're trying to fix that, please.
Okay.
Yes.
Okay, the host has asked you to start your video. Thank you.
All right. Welcome, ma'am. Thank you so much.
Yes, so good afternoon, everybody. I'm happy to be here. I'd like to thank mDoc Healthcare for the invitation. I really appreciate that, and I'd like to thank Dr. Dupe Oludipe as well for connecting me to mDoc. So this afternoon, I'll be talking about giving the presentation on enhancing maternal care through patient-centered care. Okay, so patient-centered care.
Hello, Dr. Olabisi. Sorry, are you having some challenges? I think you're muted if you're speaking, so we can't hear you.
Hello, can you
Yes,
hear
I
me
can
now?
hear you. I can hear you now.
Okay.
Are you able to go on?
Just okay. So patient, my slide is not moving.
Don't worry, we can change the slides from our end.
Okay, so let's see if I can go.
Okay, thank you. Next slide, please, so that she's able to speak to it.
Okay, so next slide. It seems you are the one moving the slide. Okay, so next slide again. Thank you. Okay, so you can see this picture here before us. The patient is right there in the center, and the healthcare, everybody in the healthcare system is revolving around the patient, and that's what patient-centered care really is all about. The patient must be the center of care. The patient must be the main focus of care. Next slide, please. Next slide. Thank you. Next slide again. Okay, so no, previous slide. So you can see the picture slide. So you can see this picture before us, but the patient is right there in the center of two healthcare professionals, but both of them are distracted, doing something different and not really focusing on the patient. That's not the type of centered care we're talking about. Though the patient is in the center, but the health system is like ignoring that client. And that's not what we're talking about today. Today, we're talking about the focus being on the patient, on the client, on the patient. Neither of these healthcare professionals are really focusing on the patient. Next slide, please. Yeah, so I'll be following this outline today. A brief introduction, definition principles, a bit about the benefits, approaches of patient-centered care, how to plan for patient-centered care, practical steps when you want to carry out patient-centered care in your facility, respectful maternity care. What has that got to do with patient-centered care? Patient engagement, challenges, and conclusion. Next slide. Thank you. Yeah, so you can, let's look at these two scenarios. You're at home, you're asleep, and you suddenly wake up and you see somebody undressing you from nowhere. And that's what happened in the healthcare sector. You know, there are patients, they're incapacitated because of one illness or the other, or the patient is pregnant, cannot do so many things that really she would want to do, but we don't talk to them. We don't communicate. We don't give information, you know, and there we are just carrying on, you know, carrying on with our schedule, our jobs, as if it doesn't matter, but it does matter. You know, we need to communicate, we need to educate, we need to inform. Or you want to go out, you're in your house, you want to go out, and you get to the door and the door is locked. You know, and you can imagine how you feel. But again, this is how our patients feel when we don't communicate with them, when they are not in, when they are not in the know of what's going on. And that's what patient-centered care in the healthcare system is all about. Next slide, please. Yeah, so as a brief introduction, right now, or let me say in the past, in most setups, you have the traditional care model, you know, but we're trying to move away from the traditional care model to the patient-centered care model. The traditional care model is the biomedical model. Everything is centered around the hospital or is centered around the healthcare professionals, you know, for their comfort or for ease of administration or what have you. It's not centered around the patient. But over the world now, we're moving away from a traditional care, a biomedical traditional care type of healthcare system to one that is the patient is part of that care. The patient is the focus of that care. The patient is involved in that care. So you are seeing the patient holistically, you know, not in a model of a hypertensive patient or a patient with eclampsia or a patient with obstructed labor, but you are seeing the person as a whole. This person, yes, has a disease, but this person also has emotions. This person has families and caregivers that are important to her, you know. So you just go away from that fixed mindset of a disease model. Oh, the patient has hemorrhage, has bled, you know, after delivery. You are not even considering what emotions that patient is going through. We are not communicating with that patient. That isn't right. And we should be moving away to a holistic, seeing the patient as a whole, as a person, not as a disease, not as a number, not as, you know, not as statistics, not as data, but seeing a patient for whom the patient is. So there needs to be a change from the old model to a patient-centered care. And that is not even only in the healthcare setting. In banking, in marketing, you start hearing of customer service, customer satisfaction, customer experience. Everybody now is focusing on the customer, on the clients. That's the important person. So all your services are revolving around that the customer. In healthcare, we say the customer is king. or queen, and that exactly should be what it is. Next slide. Next slide, please. So that's just all what we have been talking about. In maternity care, research has shown worldwide, when we're talking about patient-centered care as it pertains to enhancing maternal care, the data is not looking good at all. The maternal mortality rates all over the world could be better, especially in the low and middle income countries where the rates are still very, very, very high. It's not acceptable at all. Right now, the WHO data about maternal mortality gives the data that every day about 800 women, every day, about 800 women die from preventable causes of pregnancy and delivery. And that amounts to one woman dying every 2 minutes from preventable causes of pregnancy and child delivery. That shouldn't be acceptable to you. It shouldn't be acceptable to me or anybody. So what do? We have to find strategies, approaches, models that will take us to improved statistics about maternal health. So we have to find ways to sort out the challenges. So maternal women all over the world, especially in low and middle income countries, have some challenges leading to these high mortality rates. These include poor access to healthcare, poor interaction with the healthcare professional, exclusion from decision making. You are just making the decisions on their behalf. You are not even involving them in decision making. It's supposed to be a shared decision. Yes, they are not healthcare professionals, but they when we give them information, when we educate them, they can still be part of that decision making. So in patient-centered care, it should be a shared decision making. It should not just be you alone making decisions. We should educate them, inform them, and then together we can share our decisions. So there's a lot of disrespect and abusive practices going on from healthcare workers, whether during antenatal care or during childbirth. That shouldn't be. We should respect dignity, privacy, confidentiality. These are the rights of women in pregnancy and delivery. Neglect, harm, and mishaps should be a thing of the past. Yes, next slide. Next slide. Thank you. Yeah, so this is exactly just what I've been talking about before. The traditional model of care where everything just favors the system or favors we, the healthcare professionals, isn't the right way to go at all. We should be involving our patients in the care. We should have a care plan where two of us, the healthcare professional and the clients, have come together to say, okay, your next appointment will be in 2 weeks' time. Then you go on to ask, is that convenient for you, and all that? Because if you give me an appointment in 2 weeks' time, I cannot make it. So how has that helped? How has that helped me? So let's see the patient as a whole. Let's bring the patient in. Let's have empathy. Let's communicate. These are the things that will move the dial, in the direction of improvements in health outcomes that we desire. So the care plan, there should be a care plan that should be jointly a joint decision between both of us. We should share power. Power should not just be on the healthcare professional. I might have all the details, of course, but the patient has, the condition, the disease or the infirmity or whatever it is, 24/7, he lives with his condition 365 days a year or two, or all 24 hours of the day. So he too has power. He too owns his body. He knows how the condition is affecting her. So let's not just behave as if, yes, we are the only ones that know it all. No, it should be a shared decision. There should be communication both ways. Next slide, please. Next slide, thank you. So the patient-centered care is actually a concept, that affects how we carry on, how we do our things. There's no one decision about the definition of patient-centered care. Actually, the history dates back decades, where an American psychiatrist noticed the dehumanization of medicine, the way we just carry on, just thinking of the disease, giving prescriptions. We're not bringing in the patient into the picture, you know. So eventually, that observation by the American psychiatrist scaled down to it being put together as a concept. So there have been various definitions, terminologies for it. You know, now we don't, the trend now is not to use the word patient, but to use the word client. So instead of saying patient-centered care, sometimes in the literature you see client-centered, sometimes you see person-centered, sometimes you see people-centered, patient and family-centered. All this just to let you know, they're just synonyms, so to say, and one can understand why there are different terminologies. So patients have needs, they have values, they have preferences, you know. So all these expressed needs ought to be listened to, ought to be taken into cognizance, and then we should use this to plan the health care for that particular patient. So it's more or less like a personalized care, so to say. When that patient is in front of you, that patient is the only patient, and that patient takes 100% of, you know, all your time and all your thoughts and all that. So we should treat our clients with dignity, with respect and empathy. When mothers come for delivery, the way we attend to them, the way we behave should show that, you know, we are respecting them, we have empathy, and we are showing them dignity. You know, not exposing them when they come to deliver. That's not proper, and that's not nice at all. So the decisions we make, I've said it before, they should be shared decisions. Our clients or our patients should be active participants in their own care, because the idea is to empower them. It's not just to do everything for them. There are certain things they can do for themselves. So what can they do for themselves? You know, that should be the goal, to make them active participants in their own care. You know, what they can do for themselves, let them do for themselves. What they cannot do, let them understand, you know, why it is so. Next slide, please. Yeah, so patient-centered care has, by Pickles, has 8 principles that is known worldwide. We've been talking about respect. We need to respect what their preferences are. If the mother says, I want my if the pregnant woman in labor says, I want my husband to be with me, I want my mother-in-law to be with me, can we respect that express need? If it's possible, well, if it's possible, yeah, sometimes it might not be possible. And even in situations where it's not possible, can we explain that, sir, we have 3 other women in labor. This is an open ward. Okay, we'll use a screen at some time and bring you in or whatever, but we should carry them along. We should talk to them like they're people. We should not look down on them. So we should respect their preferences. Their care should be coordinated, not sending them from one the section of the hospital to the other, and they're just lost. They don't even know where to go to. That's not thinking about the patient. That's not centering care around that patient. Information, education, communication, that's very important. We need to let them know what's going on, what condition they have, how they can help themselves, and what have you. Physical comfort, of course, if we are centering care around the patient, we should think about their comfort. We should think about how we can make them comfortable. Emotional support is something a lot of us don't even think about. They have emotions. Our clients, our pregnant women coming in ANC or during delivery or postnatal care, they have the emotions. So what are they going through? Am I making it better? Am I even asking what matters to you? Am I inquiring about how the condition or the treatment, is affecting them. So emotional support is something we need to keep at the back of our minds, involving family and friends. I mean, if we are not doing that, we might not, because the family and friends also have a part to play, in the condition that is before us. So it's important to involve the family and friends in the care. That is now making it one of the components of patient-centered care. Continuity and access to care. Access to care is not just come to the hospital. Access to care also involves when they come to the hospital, how do we attend to them? How long do they have to wait before the doctor sees them? How long do they have to wait before the nurse does vital signs? Waiting time is key. So it's not just building hospitals all over the place. Access, waiting time also is important. Next slide. Next slide, please. Next slide, thank you. Yeah, so this picture just depicts all what we have been saying since we started. So that the important thing should be everybody, all the decisions, the system, going around the patient, and not the system being in the middle, the doctor, nurse being in the middle, and whether the patient likes it or not, he has to conform. No, we have to bring in patients. Next slide, please. Next slide, please. Yeah, so the principles, like we are really like what the components we've been talking about. So the priorities of the patients is key. Their needs, their values, their preferences, their culture, is key. If the patient says, comes for delivery, says, I prefer a female doctor, is this something we can honor? And if we cannot honor it, can we explain? So all these things, we can't just jettison it. That's no. What was she talking about? We're short-staffed. Yes, we're short-staffed. Can we carry the patients along? So that's key. So they have a right to have a say in their care and in their treatment as well. They have a right to ask questions. They have a right to make complaints and to be told about choices. And when they do make choices, we should be seen to honor, to check whether we can honor these choices. And if we cannot, respectfully explain why we cannot. Effective communication. Communication is both ways. Active listening. All those are key in talking about patient-centered care. You might have the best labor ward, the best antenatal services and all, but if we're not communicating with the patient, if the patient does not feel our care, our concern, our empathy, all those things might not mean so much to them. Next slide, please. Yeah, next slide. Yeah, so patient-centered care, like we've been saying, gives a holistic view, a personalized care. You're not just fragmenting care, you are taking the client as a whole. You are taking the client, looking at the different aspects that might concern you as you look after this client before you. So why patient-centered care? By involving the patients, you are actually empowering the patient to look after himself or herself. You are fostering good communication, empathy, and trust between you, the healthcare provider, and the patient, because you're asking, what do you think of this? What do you think of this? How does this affect you? Have you thought about this? You are communicating, you're asking for the patient's view, you are asking what matters to the patient. All this, you are drawing the patient in, and this helps to make the patient have that sense of belonging, and feel that you really care. You really care. That's important. So shared decision, bringing in families and friends, all very key in patient-centered care. Next slide, please. We might not even be able to do all, but what you can do, can you do it? You understand? So it is really important. Healthcare delivery has to move to the next level, and that's the innovation, taking up patient-centered care as a model of care for our patient. So this all we've been saying during the presentation, and they are very key. If you don't respect your clients, they go outside and talk and say, I'm not going to go there to deliver again. My next baby, I'm going to the TBA, and that's not what we want. Or they tell their neighbors, don't go to that hospital. They will shout on you when you are delivering. They will make you scared. They will put fear in your heart and all those things. They will say, you are not pushing well, I'm taking you for CS, or I'm going to give you a cut, all those things, and instilling fear. That's not right, So we have to treat and respect them. We have to treat them with dignity, confidentiality. All these things are key when we're talking about patient-centered care. Next slide, please. Next slide, please. So the benefits are all that we have been saying. You have to empower the patient, give them independence. All this improves quality of care. Quality of care, one way the client describes quality of care is, be nice to me, don't harm me. So, all these are key when you are thinking of improving quality of care and talking about the involving patient-centered care in your facility. Next slide, please. Next slide. Yeah, so to the healthcare worker, if you practice patient-centered care, there's confidentiality, respect, dignity, communication, information, and all that. Your patient is happy. And if your patient is happy, obviously, you, the healthcare worker, you'll be working in a good environment, and you too, you'll be happy. So the benefits are both ways. It benefits the healthcare worker in many ways. It also benefits the patient or the clients in many ways. Next slide, please. So all these are benefits. The quality of care improves, the patient is supported, patient is independent because you have empowered the patient to take care of himself, and it promotes positive well-being. It promotes respect. So there are so many advantages. Next slide, please. Yeah, so in patient-centered care, you don't ask again when a patient comes to you, what's the matter with you? You don't say, what's the matter with you? We used to say that. No, the term has now changed to what matters to you. And what matters to you is what you are listening to that, and that's what you are going to take into cognizance when you are planning the care of this patient. So let's stop saying, what's the matter with you? Let's start saying, hello, madam. Good afternoon, madam. What matters to you today? Because you might think you know what exactly the problem is. Meanwhile, it's something else that the client actually wants you to solve. Next slide, please. Yeah, so how do we do it? How do we do patient-centered care? So you are not talking down on the patient. You are not talking about the patient. You're actually talking with the patient, communicating with the patient, giving information, sharing decisions, doing things together, caring, having a care plan for the patient, and that's very important. Communication, we've been talking about that. That's very important. You can't know what's on my mind if you're not communicating with me, so that's very important. Next slide. I'm weary of time, sorry. Yeah, so partnership. So that's what, apart from communication as a key component of patient-centered care, we have to do this together. We have to have a care plan together. We have to agree on decisions. We have to take decisions in a shared manner, and we have to collaborate together. Doing all that is what we call empowering your patients, activating your patients, engaging your patients, as you communicate with, and all this leads to improved health outcomes, which is what we're desiring. Our maternal mortality rate is really not encouraging at all. So if there's anything, any approach, any concept that will help us do better, we need to take it on board. Next slide, please. So in planning and patient-centered care, there has to be a change. You know, you want to go from traditional, but always thinking of the disease, not thinking of the patient, to now thinking of the patient. So there must be a vision. Leadership has to come in. Training of the healthcare workers have to come in. So it's actually a deliberate, intentional decision, you know, that is taken. You plan it out, you carry out training, you start letting people know that the advantages of patient-centered care, and you know, bringing it in, all these things we have been talking about little by little, making your patients feel valued, respecting them, you know, giving them what really they should have as clients. Next slide. Next slide, thank you. So again, no labels, no numbers. They have names. Let's use their names. Let's give choices. You know, they say, oh, we have rice today. I don't eat rice, or I'm a vegetarian. Is it possible we give choices? You know, so by doing that, you are making you are giving the impression to the patient that, okay, your needs, they matter. Your choices matter. You know, you are not just saying that, no, it's just one thing, you must have it. Then I have no choice. Then it's not about me. Then it's about the hospital. It's about you, the healthcare worker. No, we have to move gradually away from that to giving patients choices and making them have that sense of belonging. Next slide, please. Next slide, please. Thank you. Yeah, so here are some practical things. You know, if a patient, if the patient says, okay, during labor, this is the position I want to take. There are different positions one can utilize during labor, but you say, no, in this hospital, you have to lie on your back. You have to do this. You have to do that. No, that means we're not listening. You know, and if one method has more advantage than the other, then that's where information comes in. Visiting time. Many hospitals abroad don't have visiting time anymore. You know, if there's no ward round going on, no, the nurses are not doing anything, you know, per se, no processes going on, can you give a concession for that husband, that grandma to come in 5 minutes, 10 minutes, even if it's not visiting time? In this part of the world, we might not be able to do all this, but at least we should know what is going on elsewhere. We should know what is right. When we can bend, we should be able to bend to accommodate this, because this is how you and I will want to be treated if we're on the other side. So empathy is key. Patient engagement is key. Many hospitals abroad, patients are part of their hospital management committee, because if you are not wearing the shoe, you don't know where it pinches. So patients are part of your hospital management committee, so that they can give you practical views of how it is, you know, from the side, and practical examples and suggestions. Next slide, please. Yeah, so respectful maternity care, again, all what we have been discussing, that we must show empathy, we must include them, you know, we must respect them. So respectful maternity care actually has similar principles with patient-centered care, because it's all about communication, it's all about respect, it's all about giving information, it is all about caring for them. And this is key in both concepts, whether you're talking respectful maternity care, where you are giving them choices, you are respecting them dignity, you are ensuring they come to no harm, and you know, you are empowering them. You know, so all these, they share similar principles, more or less. Next slide, please. Yes, so respectful maternity care is actually a fundamental human right. It's the right of the mother, of that woman, whether antenatal, whether during delivery, during labor, or during delivery. It's a right for them to be respected, to have dignity, confidentiality, you know, privacy. these are areas where we fail sometimes, you know. It's their right to ask questions. Sometimes when they ask questions, we just feel a sense of entitlement. Why is he asking questions? But the way we behave to our mothers, you know, goes a long way to affect them, whether physically or emotionally. Next slide, please. So there are many advantages. Next slide, please. Many advantages of respectful maternity care. So it makes them independent because you have been discussing with them. They are not just giving orders, just giving prescription, no explanation. They know why they know why they're taking this drug. They know why they're coming in 1 week and not 2 weeks. You know, you are carrying them along. All these even impacts on patient safety and not just being empathetic with them. It impacts on the health outcomes as well. So next slide, please. Thank you. Yeah, next slide. Yeah, so that's what the challenges of patient-centered care. It's not a model that does not have its own challenges, but when you know the challenges and you can prepare for it. So lack of knowledge, many people don't even know that the patient is king. They don't know that the patient has rights. They don't know that sharing information, educating is key, you know. So not knowing might be a reason, might be a challenge. Staff shortage, especially in this days of JAPA, might be a challenge. Doctor, how do I do all this personalized care when I have so many patients? Yes, it's a challenge, but I mean, it's good to know so that we can have solutions to those challenges. Unwillingness to even know that the patients are not even happy with what we are doing. If we're not carrying out surveys, then we don't know that the way we are carrying on, they're not satisfied with that. So therefore, we need to change. So we need to review our data. We need leadership buy-in. We need to change for the better. You know. Next slide, next slide. Talked about this. Next slide, please. Yeah, so this is just all in summary what we have been talking about. So in conclusion, patient-centered care, well, to us, it might be a new model, but they've been practicing it in so many countries all over the world. And that's where to go. And they've even found out that facilities that practice patient-centered care, not only are the patient's experience and satisfaction scores high, you know, I'm talking about patient satisfaction scores. The mDoc Healthcare has the Navi.ai. It's an online platform where there's a lot of information about where healthcare facilities can be accessed. And it's also a platform where patients can get information and patients can even grade the facilities where they have attended. So, you know, abroad, I want to go to a high grade facility, then you can go there, see the healthcare facilities and what grade the patients themselves have graded those facilities, you know, and that's in the field of patient-reported outcome. Is the patient themselves grading the hospitals, and the mDoc Healthcare has the Navi.ai for that. So patient-centered care is the way to go. So the care is holistic. You are showing compassion. There's communication. There's competence. There's you know, you are empowering the patient. You are giving comfort. You are coordinating care. So it's gone away from just I am the best doctor in the world to yes, I have the best professional knowledge, but how about the soft touch? You know, how about the emotional intelligence in knowing that, oh, I have to think of the emotions of my patient. So that's going the extra mile in patient-centered care. So the core values are individuality, autonomy, partnership, dignity, respect, rights, you know, sharing decision, you know, all these things are what we ourselves want when we are patient. When we are patients, we should be able to offer that to our clients. Stop and think and go the extra mile. Let's do the right thing. Next slide, please. So yes, we can, and we can save slide. These are some of my references. Next slide. Thank you. So patient and family-centered care is previous slide, please. It's so important that there's actually an institute of patient and family-centered care. You know, if you go online, www.ipfcc.com, you'll be able to get so much data, so much statistics, so much literature on patient-centered care. Thank you very much.
Thank you so much, Dr. Olabisi. I expect to start seeing hands and a round of applause in the chat box. Thank you for that very robust session, just, you know, emphasizing and underscoring the importance of the patient as a whole person and not just as a statistic, you know, encouraging healthcare workers to move from asking the question, what is the matter with you, to what matters to you, and just the importance of care planning and carrying the patient along. This has been very important, very robust, very engaging, and very insightful. I'd like to believe that everyone who joined this session has taken one learning or the other from, you know, how they can go back and explore ways, creative, strategic ways they can, you know, improve patient satisfaction, improve, you know, even just the improvements in care for the mother or for the pregnant woman. Thank you so much.